thanks so much for joining me and joining us for this discussion about mental health and communities of color. My name is Gustavo Molina. I use pronouns he, him, his, and el. And I am the Mental Health Literacy Specialist at Mental Health America of Greater Houston. So as some of you may know, May is Mental Health Awareness Month, and I did want to bring awareness to not only mental health, but mental health and communities of color, as it does look a little bit different for us. And so I wanted to bring some people in to share their experiences and their expertise across the field, and I'll let themselves introduce themselves. So Karuna, would you like to introduce yourself first?
Sure. Hi, everybody. Hope you're having a great week. My name is Karuna Antani. I am the program coordinator at Mental Health America of Greater Houston, and I'm also representing an organization called Dil to Dil, which means heart to heart. And Dil to Dil works to share narratives on South Asian mental health stories. So, and my pronouns, sorry, I forgot. My pronouns are she and her. And Dil to Dil works to share these stories about South Asian mental health because it is so important to normalize it in our community. So thank you. And Christy, I'll popcorn it to you.
Thank you, Corona. My name is Christy Chatham. My pronouns are she and her. And I am the Director of Veterans Behavioral Health for Mental Health America of Greater Houston. I am also a proud Army veteran, and I'm also the chairwoman of the Wellness Committee at Combined Arms. I'm so happy to not only represent women, but also women of color as far as mental health and the challenges and the successes that we have overcome through our life's endeavors. So thank you so much, Gustavo, for the opportunity. And I look forward to partnering with you all in the future. I will ping it to Agnes.
Thank you, Christy. Hi, everyone. My name is Agnes Howe. I am a licensed Master of Social Workers, and I am serving as a Director of Student Wellbeing Office over at the Rice University. So at Rice, we do offer clinical counseling, wellbeing advising, case management, and also all the wellbeing outreach and education program for Rice students. In the last month, we are very excited to collaborate with Mental Health America of Greater Houston to launch a couple series of webinars. So thank you so much, Mental Health America of Greater Houston, for that opportunity. And today, I am very excited to be here to share all about my experience with you when working with our students or like clients in colors, and I also consider myself as a person in color because I was born and raised in Hong Kong. I grew up in Hong Kong, and then I come to United States for grad school like 15 years ago. And I never thought, I would stay here for that long, but I did. And I'm happy to share, my cultural background as an immigrant, as a Chinese American. And thank you so much for having me to be here. And now I will turn it to Dr. Gordon.
Thank you so much. Good morning, everyone. My name is Dr. Teandra Gordon. I'm a licensed marriage and family therapist, and I serve as Senior Director of School-Based Behavioral Health with Legacy Community Health. We currently have 21 school-based clinics across the Houston area, and I oversee the behavioral health portion of our program. My pronouns are she and her, and I am a Black or African American woman.
Great, thank you so much. To get ourselves started with questions, so like I mentioned, this is meant to be more of a discussion. So for everyone in this discussion or everyone in this meeting, if you have any questions, if you like to type it and paste it into the chat, we're going to try our best to answer them. Our communications manager is also on this call, so she'll also help us with making sure that we get to your question. So feel free to ask questions, or if you want to unmute yourself, I believe there's also a raise your hand feature where you can kind of remotely, virtually raise your hand to ask a question, and we'll make sure to answer your question. But to get ourselves started, I wanted to ask our panelists, what were your experiences or messages around mental health as you were growing up?
felt like I was very fortunate. My parents actually were really open to mental health. So they actually divorced when I was 5 years old. And I went to see a therapist at that time in my life. When I was a teenager, I dealt with depression, and they took me to see a mental health professional at that time. And I think those positive experiences growing up are really why I'm in the field today. So I was very fortunate in the sense that they were open to mental health.
So I can pick up from there. Thank you for sharing. That's amazing. That's really commendable. For me, my experiences or messages were kind of not, they were kind of opposite. It wasn't really talked about, which is very common in our community. I am Indian by descent. I'm born and raised here. But in our community in general, South Asians, it's not really talked about. There's a joke that a comedian, Hassan Minaj, makes where, you know, if you tell your parents you're depressed, they'll go tell you to drink water, or they'll go tell you to take a nap or something. And that's actually really common in our community. But thankfully, as times are changing, as mental health is coming more and more into the limelight, it's being more accepted. But yeah, growing up, it was not really, it was kind of, you know, put under the rug. So
And absolutely, I can pick it up on there. I think a lot of like, you know, man, a lot of like Asian culture, there's still like a strong stigma about mental health issue. And I remember growing up, when every time I'm stressed or I throw temper tantrum as a kid or teenagers, my mom would bring me to see a Chinese doctor, and then I was prescribed with like some herbal tea, and assuming if I drink the herbal teas, then I will, you know, calm my body down because there's too much fire in my body, and that's why, you know, I need to calm my body down. So I remember growing up, there's a lot of like misconception about like mental health. You know, we'll treat that as a somatic symptoms, or like a physical health issue.
That is interesting, Agnes, with the green tea. Maybe that'll help as well. Me as well. My family, I grew up in a Christian household. My grandfather was a minister. My dad's a preacher. My uncle's a preacher. So I grew up in church. And I have the story of a lot of African Americans where if you felt depressed or sad, you didn't necessarily call it depression. You prayed about it, and you talk to God, and God would will hear you, and you'll be okay. And so mental health took on the form of a spiritual journey. So it wasn't like my family didn't acknowledge that I had issues, or there was depression, or anyone in my family. You know, we had struggles. It's not like we didn't acknowledge it, but the remedy was to pray about it. And so as I've gotten older, and especially post-military, I've gotten more in tune with what those things that I was feeling then, what it is specifically called, and how I can specifically help it in tandem with my spirituality. And so learning that not only can I pray about it, but I can also talk to a psychologist was a journey over time, but not necessarily when I was younger. But I do couple that with therapy and other things along with my spirituality.
Definitely. Well, thanks for sharing that. And myself, right? So I am Latino, primarily Mexican American, and so I also heard some of those same messages, right? That as men shouldn't have feelings or boys don't cry, but as well as that, you know, mental health is someone for those that are crazy, or it's not something that is real. And so it wasn't until I went to college that where I heard that, you know, mental health is for everyone, and it's something that we should be talking about, which is why I decided to get my degrees in psychology. And now that I work for this organization, I still see some of the stigma and the pushback from my family as, what organization you work for, or what do you do? Do you deal with crazy people all day? But so that is, it's, you know, the stigma's still there, but it's definitely something that we should talk about. So thank you so much for being vulnerable and sharing your experience. And again, for those that are participating as audience members, if you have any questions, feel free to type them in the chat box. Or if you would like to unmute yourself, you have the ability to unmute yourself and just ask. But For now, if there aren't any questions, we do have some that are prepared. So I'll go ahead and ask the next one. So the next question is, what do you see as major barriers for your specific community? There are several here represented. What do you see are some barriers in getting adequate mental health care?
I think one barrier, I'll go ahead and start. One barrier that I have seen in peers of mine and sort of experienced myself is when you're younger, you are dependent on your family or your parents' insurance, usually, right? If you have insurance, you're dependent on them to drive you to the doctor, on them to drive you anywhere, to get the permission to go. So I think that's a big barrier sometimes, is like you have to have that conversation, and a lot of times that conversation will go as them kind of dismissing it or saying like, oh, it's fine, just go study or something. And so I think that's a huge barrier. Until you are independent, sometimes you don't have the ability to make that move to gain access to therapy. A barrier I'm seeing right now during COVID-19 is that I have friends who want to get teletherapy and they want that access and they're open to getting that help, but because they're staying at home with their family, or they're staying with people who would kind of look down on it or overhear their therapy, they're not able to get access because they're like, how can I talk to my therapist about what my family is doing if my family can hear me? So there's all sorts of, again, stigma related problems that are faced. So I think that's a huge one, is how helping your family understand why you need it and helping them kind of give you that permission if you're younger.
Yeah, thanks for sharing. Christy, were you going to talk next?
Sure. I piggybacking off of what Karuna said, stigma is definitely a barrier, and I will add to that stereotype with mental health. Again, a lot of people that in my community, they think, you're crazy if there is an issue, if there's a mental health issue. And knowing that anxiety or depression is a part of a lot of our journey in life, I think that, like, anxiety is kind of like when you blink and if there's dirt or dust flying at you and your eye automatically closes to blink to protect your eye. I think of anxiety in that way. And so anxiety is your body telling, or your body telling you that this trauma, this crisis, I am not used to. And it's a way to protect yourself. The problem is when we remain in an anxious mode and we remain anxious. And so transferring that, realizing that anxiety is okay, it's your body's mechanism of defense, but then transitioning that into a healthy response of being aware and of understanding that, okay, my body had this response, my mind, my emotions had this response. Now what do I do with this response? Also, I believe a barrier is healthcare. Of course, Obamacare helped to shrink the gap between the uninsured and the insured. However, 15.9% of African Americans compared to 11.1% of white Americans are still uninsured. And so that access to care is also a barrier for African Americans, because it's hard enough to get the health, and then to try to obtain mental health on top of that can also be a deterrent from actually seeking it. I know Karuna is a part of our integrated healthcare team at Mental Health America. And so understanding that your mental health and your physical health is equally as important. They operate in tandem with each other. And if one of those is off, it will affect the other. So just understanding as a people that the importance of your mental health is just as important as your physical health will help to prevent barriers to access of care. And Dr. Gordon, do you have any other ideas of barriers?
Yeah, I mean, I think you guys definitely hit it. Stigma is a huge thing, and just my perspective on that is that life is difficult, and we all go through difficult times, and getting help through those difficult times, there's absolutely nothing wrong with that. I love the work that we do at Legacy, because I feel like a lot of it is focused on removing those barriers. You know, the barriers, we don't turn people away due to inability to pay. And I think being on school campuses, having therapists on school campuses for the next generation is kind of normalizing mental health care as part of a school experience. So I think that is definitely a step towards removing that barrier of stigma. But I think that it's just important for people to realize that, as you said, Christy, just like accessing physical health care is such an important part of overall wellness, same thing with mental health. And just because you're accessing it doesn't mean that there's something inherently wrong. We all have an element of difficulties that we experience, and getting help is just kind of a proactive way of dealing with things.
And I would say for me, working in a university or college settings, I would say like this new generation actually is more and more open to talk about the mental health concerns, which is a good thing. But still, I think it's because within this community, if we provide like a safe place for people to talk about it, they're more willing to be more vulnerable, right, to share their experience or be able to seek help. But then on the other hand, if you ask our students, were you able to tell your family about your concerns? And majority of the time, they might say, no, I just wanted to keep it here. And that bringing back to many different culture too. I think like in particular, when we talk about, Asian or like Chinese culture, it's very important to keep things within your family. You're not supposed to talk about, right, your issue in particular, if you're not feeling well, you're not going to disclose it to someone else, because you're supposed to deal with it within your family. You're supposed to keep this positive health image, but not telling everyone you have issue. That's a lot of shame into that. So I think that create a big barrier for individual to get help. The other thing that I want to mention is when we look at from a cultural lens, we often will stigmatize or even marginalize a certain type of people too. But then when we work with individual, we really need to start where they are, even though they might come from the same ethnic group or a cultural group, but their experience could be very different. Like I'm a Chinese American, but I'm a new immigrant. That would be very different than when you talk to a third or fourth generation of Chinese American too. So I think for providers, for mental health providers or any health providers, it will be very important for us to be, have that culturally competent to, work with clients. And sometimes it's hard, right? Because we won't be able to know and learn all the culture, in the world. And here, especially in Houston, we are so diverse, right? Every day we come across with different clients and, people from all over the world too. So lacking that culturally competent, training as a provider, somehow it create a lot of barriers for us to treat our clients as well.
That's amazing, Agnes, because we share a lot of the same stigmas in our community as well. The Black family tends to keep things very private. So a lot of times we don't share and go reach out and get help because you're supposed to keep it within your family. With my family, we'll pray about it. And then, we move on and hopefully it'll work itself out. I also think that another barrier within our culture, within my culture, is with physicians and medications. So I don't know the actual percentage, but I do know that white Americans and physicians, their physicians are more apt to give white Americans medication or even hear their actual issues, their health issues and mental health issues. They're actually more prone to give white Americans medication over Black Americans. And so when you're there, the hardest thing will probably be to even go to a mental health counselor or to a psychiatrist. So you've already taken that hurdle. But then once you get there, trying to find a physician that can understand your plight, understand why you're anxious when a cop car passes by you, or understanding what it's like as an African-American man to see a police car pass by you, and those anxieties that come with that, and those, our years of racism and slavery, all of those things that make us as African Americans who we are, those things actually are added to our mental health treatment. And so if you have a physician that can't necessarily empathize with culturally what you've experienced as a people, then it'll be harder for them to treat you based on or taking these into consideration. I wanted to point out that 13.2% of the US population is Black. 16% of those have a diagnosable mental illness in the past year. And that's over 6.8 million people. That is approximately more than the population of Chicago, Houston, and Philadelphia combined, just in the Black community, that have been diagnosed with a mental health illness in 2016. So I think physicians should really keep that in mind, that it's a great number, because that means that we're actually seeking that actual care from a mental health provider. But I think it's just as important for the mental health provider to understand the plight that we've gone through as a people.
Yes, thank you. And that was one of the questions I had prepared, right? So how do different aspects, to get real, right? You mentioned some of them, but really racism for those that are low income or even live in poverty, or the either generational trauma or even trauma that we go through, that shared trauma that we see in our communities. How do you think that impacts mental health and seeking help for mental health? I think for Christy, you touch a little bit on it, right? But you don't have to answer this. Just kind of reiterating the point, right? Like that you touch upon, like that those aspects do impact us more, right? We kind of have that weight on our shoulder more as we kind of think about, we see, you mentioned it, right? Police brutality is one of the biggest aspects that can impact or it does impact our mental health. We for some of us, we see a police car or we see other authorities and kind of think, well, am I physically safe? And then that impacts our mental health. So I'm interested to see if anyone has any other thoughts on that, or anyone in our participating audience, if anyone has any thoughts on that.
I guess I can add a little bit to that on the kind of Indian perspective. There's kind of a phrase that's being popularized right now because it's so common in our culture. It's called "Log kya kahenge." That's Hindi for saying "What will people say?" And so that's really common in all sorts of areas that we struggle with, but in mental health specifically, it's very common for a parent to say, like, what will people say if they find out you're going to a therapist? What will people say if they find out that you are taking medication for a mental health disorder or problem? And so having that be so ingrained in our culture that it's become like a norm that all of us can relate to this one phrase, it's just amazing to me. And it's something that is being worked on to be changed, but it's still very prevalent where, that cultural just rooted thought process of like, what will people say? This whole, I think it's a trend in our what we've been saying, that, people like keeping things within the family in our cultures. And it's really important for, I think another layer of that is it's important for the family's image to be clean, or like, to be without any problems. And, oh, all of our kids are are wonderful academically and they do all these extracurriculars and they're perfect, and having that perfection on the outside is something that's like they strive after that. But what needs to be understood is that striving for greatness or striving for excellence in academics, these things can come with those stressors. And I think that is what needs to be accepted, that yes, we can strive to be great, but at the same time, we should be open to handling the stress that comes with it.
Definitely. Thank you, Karuna.
You all made some excellent points, and I think that gosh, that what will people say thing is really powerful. That's why I'm really big into vulnerability, into authenticity, into genuineness, into being open about my story, and helping other people to do the same, because with greatness, like, there's no such thing as perfection, right? Like, with greatness comes struggle. With reward, there were some failures along the way. And so just normalizing that, I think, is so important. And it starts with each and every one of us doing it within our own families, within our own communities. Another thing that I just wanted to mention about what you guys were saying earlier about just culturally competent mental health professionals. That's why I think it's so important that as mental health professionals, we remain curious. We ask questions to really understand the experience of the people that we see. We should come in with a certain amount of knowledge and understanding, but at the same time, always being curious about people's particular journeys and people's particular perspectives and people's particular experiences. And I think, if we can do that, then we can be effective helpers across culture.
Exactly.
Back off of that, if you don't mind. You speak about telling your story and being kind of representative in your own family, for example. So that's a lot of work. I just wanted to mention this. That's a lot of the work that Dil to Dil does, the organization that I am a part of. I'm actually the collaboration team chair. So what we do is we look for other organizations or big influential South Asian personalities to come on our platform and talk about mental health. That way, these people or organizations that many South Asians relate to or really listen to or hone into in terms of their content, they all get this message, and it's kind of on a broad scale. Like, this big personality is saying that mental health is normal and you can talk about it, and they're sharing. Even like, we started off with doing takeovers, which was kind of bringing on community members, to talk about their mental health and to express how they take care of themselves and all of that, so that people realize, oh, I'm not alone in this journey. I'm not the only one feeling this way. Because sometimes the rejection from family or friends or community culture, that can make you feel like, oh, am I the only one who feels anxious? Am I the only one who's feeling depressed because everyone else looks perfect? So that's a big mission that we have, is to culturally normalize mental health.
That's one thing that we always emphasize when we work with our students. Mental health is actually something that we all need to have, right? If we just talk about like a general mental health, it's something that can help us to like cope with different situations, so that we know we feel great, we feel accomplished something, and it gives us energy, right, to move on to the next task. And I think like there's also like a misconception when we talk about mental health, it must be negative. But no, actually mental health could be a wide range of different things. And we all, need to learn, like different ways to cope with different situations. And of course, in many different community, when we talk about mental health, Gustavo, you just mentioned about racism, poverty, right, trauma, mental health diagnosis. Of course, this is like very, very uncomfortable to talk about that. Dr. Gordon just talked about, it's hard to be vulnerable, right? It takes a lot of courage for you to be seen, to show up, to talk about that. But if we want to look at like a wide spectrum of mental health concerns, we can start early on, right? We can start talk about our mental health early on. It might be, from the beginning, just to, concerned about our feelings, right? Starting from like a wide spectrum, from maybe like, yeah, I'm not like feeling well, or I might started to feel, anxious, to a point that, yeah, I might not have motivation to do a certain things, or I might started to have some relationship issues. So those are, actually very concrete things that we can talk about. And it's also like mental health related. And of course, if things started to impact your daily life functionings, that is the point that you might want to consider to seek some more professional help. But what we encourage very often our students to do is start with someone that you trust, start with someone that you feel comfortable to talk to. It might not necessarily need to be a mental health professional first. It might be someone, next to you. It might be someone that, in your church. It might be someone that, in your family member, that you feel good to talk to. So I think we need to start from there. So, we won't be feeling like, it's so difficult to talk and start the conversation.
Yes, definitely. Thank you so much for sharing that. Yeah, Chrissy, sorry.
I just wanted to add that I think it's Darren, or I hope I said that right. He said that communities in color are in survival mode. And I know in the Black community, that is absolutely true. So imagine you're in survival mode. I mean, I'm a veteran, so survival has a whole nother meaning. But imagine being in survival mode 24/7. And then you have to go to work and try to maneuver around being in survivor mode, because being a survivor, going to work is different. So as African Americans, we have to think about the things we say, how we say it. If I raise my voice, am I seen as an angry Black woman? Am I overly aggressive when I'm just excited? And so those things, and I had to do the same thing when I left the military, about being mindful of my aggression or passion and those things like that. And so I think it is very important to note that being in survival mode does affect our mental health as well. And so if we have to make sure that we have conversations with our family first and create a community and a familial unit that can have those conversations. And then in the faith-based community, my church, the Church Without Walls, does a great job, especially in our women's ministry, do a great job of discussing mental health, especially during this time. But we try to keep our mental health in the forefront of a lot of the things that we do in our women's ministry. And so your familial unit, your faith-based unit, your community, and also your physicians, those surrounding you, will help you move from survival mode to thriving. And that's what we really want for all of our communities, is to transition from surviving to thriving. And all of those entities working in tandem will help us get there.
Definitely. Thanks, y'all, for providing that perspective. I did want to turn our attention to some of the questions that are being asked in the chat. So, Nicole, you asked the question or the theme around for our panelists, how do you feel that our cultural lens, whichever community you come from, how do you think that impacts how we address and look at trauma or grief, right? Especially right now with COVID going on, we're seeing grief happening all around us, whether we're affected personally because of COVID or because we're seeing it somewhere else, or trauma and grief around, brutality or kind of trauma against our own communities, or just in general, right? How do we deal with that? As I know that several of our communities have different customs for those that pass away, or different customs and different traditions around trauma and grief. But I'm interested to hear your perspective on how that our community cultural lens impacts how we address and look at trauma and grief.
I can say that within the Black or African American community, we've experienced cultural trauma for many years in many ways in this country. When you think about slavery and over 300 years of, being viewed as property, of being in survival mode every day, all day, that weighs on a human being. And then when you think about, the next generation after that, and because I'm really into parenting. I wrote a book on parenting, and who we are impacts who our children become, right? And so when you talk about descendants of slaves, their experiences impacted the next generation. And then that next generation had to deal with Jim Crow laws and racism on every level. And so those experiences impacted the next generation. So I think as a culture, we're still trying to move from survival mode to thriving mode. And I think that's part of our plight and part of our journey culturally is to keep trying to grow in the midst of the cultural trauma that exists consistently. And then things, like, what happened a couple of weeks ago, what happened a few months ago that came to light a couple of weeks ago with the Ahmaud Arbery, I think I said his name right. And just the idea that, things constantly happen that bring that reminder of the trauma that has happened over many years. And so it is a consistent thing within the Black community, trauma, and constantly trying to work through it. And I think that the solution is to have those open conversations in our families, in our church communities, with mental health professionals, to constantly be aware of what's going on, what has happened, in our history, and what is going on in current day, and how it affects our mentality and our mental health. It has a profound effect, and I think that as a community, we have to continue to address it.
Going off of that, thank you so much. That was really insightful. Something that something that I have kind of seen, it's a term called intergenerational trauma, right? You're talking about the same thing. It's very common in us as well, in Indian American, I guess, this generation that I'm in. Our parents or our grandparents have immigrated from India to here, or my parents actually immigrated to like 3 different countries and then came here. So having that experience kind of projected on the other generation, right? Like saying, you have to do this to survive, whereas I'm born and raised here, so my experience is totally different from theirs. But sometimes they end up, a lot of parents or grandparents end up trying to tell you to live the way they did because that's their experience. So kind of passing down trauma over generations is common for us as well, and trying to navigate that and maybe just have that communication to within a family, within friends, within your community, to say that the way trauma occurred for you is different than what happened to me. Therefore, that attitude or that way of coping should be tweaked for the next generation, and it should not necessarily be just passed down over and over again, because then that healing just does not happen, or it's halted, it's stuck in the same generation from years and years ago. So that's really important to acknowledge.
Yeah, so I would pick from there, and I would say like trauma, if we look at the term trauma, right, it refers to experiences that cause intense physical and psychological stress reaction. So it's basically, we refer this as a, very abnormal situation. But then for us, like when we deal with trauma, it's very much like, our body and mind trying to be in this survival mode, try to protect us, right, from all these traumatic events. And it could be like a single event, it could be like a multiple events, it could be a set of circumstances, or it could be, we just talk about like an intergenerational like trauma. So I guess, from a cultural lens, and which I agree, right? Like, that could pass from generation to generation, even though maybe like, in my generation, the traumatic events that I experienced may be way less than my parents, back in the days. But still, when I hear from the stories that they told me, I could visualize how hard they are. And then, it also changed my whole values as well. And as a social worker right now, it's very important for me to like keep that in mind. When every time when people like tell me that there's like traumatic events happen, including right this COVID-19 right now, it's important to have that like trauma-informed practice, which means like we might not fully understand what exactly exactly happened and, the trauma behind that. But then we will need to do an approach. We will need to have an approach to really engage people with the histories of the trauma, that recognize like the presence of trauma symptoms, and be there and acknowledge the role that trauma has placed in their life. It's not necessary that you need to be a mental health professional to practice trauma-informed practice. All we really need to do is to relate what exactly happened. Be empathetic. Inform about like how you're feeling about that. But the most important thing is to be sensitive, to recognize how traumatic it could be, and be there for them, and be able to like openly listen to their stories. And that's very important.
Definitely, thank you for sharing that around trauma-informed practices that we can all do, right? Not just those that are actively practicing mental health or counselors, but those even those loved ones, right? Because at one point we are all trusted individuals to someone, so it's important to make sure that we are providing that support adequately for others. We've kind of been talking about this throughout the discussion, but how do you think we can move forward in improving the mental health for communities of color in your specific community, right? Particularly with our children. I know someone in the chat asked, how do we have this conversation with our youth, whether it's in the school setting or whether it's as caregivers, as parents. How do we move forward in general, or how do we have these conversations with our children and kind of support that mental health? If anyone would like to go.
I can start. So for children, I don't have my own children, but I have two nieces who are 5 and 3, and so they're still really young. But sometimes the 5-year-old, or one of them will get really angry or like just irrationally, they don't have the chocolate they want or something. And tantrums will happen. So something that I've learned a lot of mindfulness exercises and things like that. So even starting from there, I think is so important to introduce that as early as you can. So I tell her to take 5 deep breaths, or like something I do to make them focus is like look at my nose, like something silly to make them kind of stop thinking about what they're throwing their tantrum about. I'm trying to introduce it that way with my own nieces. And then on the flip side, something to do in general culturally for especially South Asians. I'm sure this can apply in other ways, but what happens in our culture a lot is if we are born and raised here, our parents really want us to keep our culture. So they don't want us to lose our languages that we like from India that they've carried on here, or dance, music. That's very important in our culture. And so growing up, we'll be in singing classes and dance classes, just to maintain that relationship to India or whichever country you're from. And so within that, intertwining mental health into the cultural kind of norms or cultural practices, I think that's really important. And it's something that I do. I'm a dancer, and I teach a certain form of dance, and we have kids classes. And so something that my mentor has brought in is mindfulness in our Indian cultural dancing. And so in the beginning of class with the kiddos, you'll do a mindfulness exercise and talk about that, and then we'll like dance it out. So I think it's important to bring that, to bridge them together, to bridge together culture and mental health, so that it's not some, random thing that's come out of nowhere, and it's not as daunting. It's kind of just in the flow of things that are already happening culturally.
I love to dance. So that's awesome, Karuna. I wanted to share with our children, if our parents, that in 2017, suicide was the second leading cause of death for African Americans between the ages of 15 to 24. In grades 9 through 12, and African American females were 70% more likely to attempt suicide than their white counterparts. If we are not talking about mental health to our children, we need to start now, because their lives are at stake. It is that important and that imperative that we have those conversations with our children, even if they aren't as forthright and forthcoming with how they're feeling. Ask them. I know that at Mental Health America of Greater Houston, we have an implicit bias training through the Center of Behavioral Health. And they actually go into schools and train administrators and teachers and parents on implicit bias. Some implicit bias, we don't even know that it exists. And for some of those biases, we are aware of them. Also, mental health at Mental Health America, we have a mental health screening. So if parents, if you aren't comfortable with having that conversation with your children, or even where to start, I would start with going onto our website and having them complete one of those screenings. And then based on those results, start having a conversation with them about how they're feeling. If the result is that they are depressed. Okay, well, now you have a place to start. You're not starting blindly with having a conversation with your children. I don't have any children. I've been raising children since I was 5, but I do have nieces and nephews. And so I try to be supportive of them, even just calling, my niece a princess, or those positive things that they get to hear from you that they may not hear at school. But reinforcing their intellect, reinforcing their beauty, and all of those positive things in their life. They may not get it when they step outside of your doors, but at least when they're home, they know that they have a safe space. So I really think that that tool will really help at least initiate the conversation. And it also will be a tool to help you to educate yourself on the particular mental health issues. Then you can take that and actually print it, take it to a doctor, and that'll start that dialogue. So you're coming from an educated standpoint on a mental health issue that you may not be versed in. So I really believe that having that open dialogue and conversations with our children will definitely keep them from attempting suicide, or heaven forbid, actually going through with the act.
Thank you for bringing that up, Christy. And I think, that's really real and true. The suicidal rates that we've seen in the last decade, the age group has been much younger and younger. And I believe part of the reason is due to the technology and, the smartphones and social media is so accessible nowadays. Our children will be able to access all these information everywhere, right? Simply looking at their phone or computer. I mean, good and bad. The good thing is they will be able to access, a lot of information. But as a parent, sometimes, it's so hard to know what information's, in the smartphone or in the computer. And that's very scary as well. So it's important, to set boundaries with the student and maybe put the phone aside, put the computer aside, and really have that conversation with your children. I have 2 young kids, 5 and 2. So yes, that's also important to start early on by talking about it, by give a name to the feelings. I think growing up, especially as a Chinese, in a lot of Asian, culture, we don't talk about our feelings enough. Sometimes we don't even have a word to describe that. And that's really difficult because if you don't name your feelings, if you don't name how you feel that's really difficult to acknowledge, where you are in your mind right now. So teaching students, teaching, your children how to, give a name to the feelings. If they might not be able to say it, then encourage them to draw it, right? Draw it out, even though just scratch the paper, right? But then it's really important to express it out or help them to visualize, how do they feel? And I think that is very, very much the first step to acknowledge that. And then you can start the conversation by asking, more questions, right? What makes you to feel like that? What exactly happened? Can you tell me more? So having those dialogue is very important. Of course, for, older children, teenagers, or even college students, I think, it really, again, based on where they are at that point and really being non-judgmental, as a parent or as an educator, sometimes it's hard because we do have judgment. We do have biases. We want to teach our student, we want to teach our children a certain way, but for us, maybe the first step we need to do is to maybe shut our mouth up, be there and then listen to them and, exactly like ask them what happened from there. And in that way, then, they will trust you more and they would like be able to feel more comfortable and safe to tell you much more of like what's going on in their mind.
Yeah, thanks, y'all. And similar in the Latino community, right? Especially for those that have a different language. Particularly for me, I am bilingual in Spanish, and my family speaks primarily Spanish at home. And I think that sometimes one of the barriers or something that happens is that the inability to discuss mental health in Spanish, right? Because sometimes as mental health providers, or even those that work in the field, or even those that don't, our trainings or our education sometimes is in English or is in English. And then we don't have the necessary tool set, right, to talk about it in Spanish. But a lot of you are mentioning, right, equipping ourselves with the small tool sets, right, but the small but mighty tool sets of, being able to have a vocabulary of different terms of how we feel, or just being able, can we talk about this, and kind of ingraining that in with our families, building that trust with each other, and then discussing it, right, and definitely researching those terms and translating them, or talking about them in different languages, or at least for myself who speaks primarily Spanish at home, or kind of explaining it for it to be more accessible for parents or family members who primarily speak a different language, because a lot of the resources that exist, right, are great, and they do exist, but a lot of them are in English, so they're inaccessible to those that either don't speak it or who may not understand it fully. So that's one way that we can definitely promote. I think definitely too with the rise in technology, especially right now, there's a lot of different resources, but something that I've done and continue to try and do is sharing resources, sharing information, and sharing messages on personal social media, because we do have, as much as we say we don't, right? We do have some influence over friends and family members who follow us. So even if they don't reply back and say thank you for this, you have some sort of influence on people, or it's good to see those reaffirming messages on someone else's social media. So I know that Karuna and I are colleagues, but we're also friends outside of the office, and so I see her own social media, and she does share reaffirming messages that it helped my own mental health. Thank you for sharing those. We are drawing close to the hour. I don't know if anyone else has any comments on the panel, or for anyone our audience member who are joining this, if you have any questions, feel free to either type them in the chat, or for kind of unmuting yourself and asking them. So we'll continue this conversation up to the hour. Before we leave, I do want to kind of state that we do have several events. For May is Mental Health Awareness Month, and so there are some more events. We have 2 more weeks of May, so we do have some Facebook and Instagram lives, both on Tuesdays and Thursdays. So feel free to join us as you can, and they are recorded and posted later. But of course, mental health goes beyond May, goes beyond a month, an awareness month. So make sure that you continue having those discussions, and visit our website for other events that are going on. So anyone else on the panel have any other final comments for our audience members?
So I had one final comment on just the idea of culture and mental health, and kind of parenting, and how do you promote mental health and in parenting. So I have 5 kids. My oldest I have a 16-year-old son, and then I have a 14-year-old daughter, a 10-year-old daughter, an 8-year-old daughter, and a 2-year-old daughter. And one thing that I truly value is sharing cultural experiences with them, making sure that they know their history, making sure that they know that they are where they are, not just because of themselves, but because a lot of people over the years have sacrificed and have went through a lot of things for them to be where they are. And I think that that's really important. When you were talking about like passing on culture, for us to do is to share those stories, but at the same time create a space for them to have their own story. And I think that as parents, staying connected and promoting mental health, we should create opportunities that promote connection with our kids and communication, promote rituals in our family that keep us connected and keep us communicating. I think that's how we constantly know what's going on with them. As adults, we should model kind of coping skills and model sharing feelings and model sharing experiences. I think that becomes a great example for our kids and creates an atmosphere where they can do the same. So that's a big thing for me. It's like parenting, and it's just so important for us to create a better world for the next generation and for us to keep progressing in that way.
Thank you so much, Dr. Gordon. I just have one quick point to end up. Make sure to take care of yourself too. We all deserve to take care of ourselves before we take care of others. So self-care is important.
Great point. Agnes, I want to tell Gustavo, thank you for this opportunity, for putting us all together. I hope I'm not overstepping, but he's the newest member of the MHA team. And for you to come in and put this together and just the awesome work that you've done, I think in a month, 2 months, maybe. I applaud you, my friend, for this opportunity. When I look at the comments, I see that people were affected by this and also gained some knowledge. So if we can pass along knowledge, I think it was a success. So thank you so much, Gustavo, for your work and putting us all together and for highlighting mental health in communities of color.
Of course. Thank you for joining us. For those that are in the audience and for our panelists, thank you so much for sharing your experience and sharing your thoughts around this topic. Like I mentioned, you can visit our website, mhahouston.org, where we have more information about different topics. And you can check out more information through our Center for School Behavioral Health for resources for caregivers, parents, and students, right? And then for those that are either providers or maybe are a leader in an organization, we do offer some trainings, train the trainer kind of training. So you can definitely reach out to us if you'd like to provide those as webinars or trainings for those that you lead. So thank you again for joining next week. Like I said, join us live on our social media, and I hope that you have a great day. All right, thank you.
Bye, everyone. Thank you.
Bye.